1. Arizona plague death. First fatal case since 2007. Explain pneumonic plague risks. 2. Arizona resident dies from rare pneumonic plague. What you need to know. 3. Understanding pneumonic plague. What you need to know. 1. Arizona plague death. First fatal case since 2007. Explain pneumonic plague risks. It's shocking but true. Arizona has just recorded its first plague-related death in nearly 2 decades. That simple fact alone raises questions about how a disease notorious for devastating medieval Europe can still claim lives here in the 21st century. So what happened, and does it mean you should be worried? According to officials, a resident from the northern region of Arizona, specifically Coconino County, home to the city of Flagstaff, tragically passed away after contracting pneumonic plague. This is no run-of-the-mill illness. It's the very same bacterial infection that infamously swept across Europe in the 14th century, wiping out up to 60% of its population in just a few short years. Back then, society reeled in fear at what was called the Black Death. Now in our modern era, such cases are quite rare. Federal data reveals the U.S. sees only about 7 human plague cases each year, mostly in western states like New Mexico, Arizona, Colorado, and parts of California and Oregon. Here's where it gets controversial. Despite its grim history, the plague is now easily treatable with antibiotics if caught early. Yet, preventable deaths can still occur. Is it a lapse in public health awareness, access to healthcare, or simple bad luck? Opinions may differ widely. As for the recent Arizona case, local officials have withheld specific details, including the name of the individual, out of respect for the grieving family. Patrice Horseman, who chairs the Coconino County Board of Supervisors, offered heartfelt condolences to the loved ones affected by this loss, emphasizing their desire for privacy during a difficult time. Want to know what most people miss about the plague? It's not just about the history. It's also about the different forms this infection can take. Bubonic plague is the most commonly known, but there are 2 other types: septicemic, which spreads throughout the body, and the particularly dangerous pneumonic form, which targets the lungs. Pneumonic plague is both the deadliest and the easiest to transmit from person to person, making it a top concern for public health officials. Transmission remains deceptively simple. The bacteria primarily spread through the bites of infected fleas, which hop between wild rodents like prairie dogs and rats, sometimes bringing the disease to pets or humans. Occasionally, plague can spread via direct contact with infected bodily fluids, so handling sick or dead animals should be done with great caution. If you live or travel in rural areas of the western United States, the Centers for Disease Control and Prevention (CDC) advises being especially watchful. And here's another angle that invites debate. Between 1970 and 2020, there were 496 confirmed cases of plague in the U.S., the overwhelming majority in the desert Southwest, with New Mexico leading in reported incidences. Notably, just last year, a resident in southern Colorado was diagnosed with plague, following a fatal case in New Mexico earlier the same year. Such trends beg the question: are climate change and shifting wildlife patterns increasing our risk, or are we simply doing a better job of detection today? So now it's your turn. Do you think health agencies are sufficiently informing the public about these rare but serious threats, or should greater awareness campaigns be waged? Could changing environmental factors be contributing to outbreaks, or is the risk largely overstated? Share your thoughts. Should we treat plague as a present-day threat, or as a relic of the past that's unlikely to touch our lives again? 2. Arizona resident dies from rare pneumonic plague. What you need to know. In a shocking turn of events, a resident of Coconino County, Arizona, has succumbed to pneumonic plague, marking the first fatality from this disease in the area since 2007. Health officials have clarified that this tragic incident is not linked to a recent die-off of prairie dogs in the vicinity, which may also be associated with the plague. On July 11th, health authorities confirmed the death, which occurred in a region that includes part of the Grand Canyon National Park and is situated north of Flagstaff. Pneumonic plague, a serious lung infection, is quite rare among humans, with only about 7 cases reported each year in the United States. Unlike the bubonic plague, which devastated Europe centuries ago, pneumonic plague can be transmitted through the air via respiratory droplets. Both forms of plague are caused by the bacterium Yersinia pestis. However, while bubonic plague is typically spread through bites from infected fleas or contact with contaminated materials, affecting the lymph nodes, pneumonic plague leads to pneumonia and respiratory distress. The individual who passed away, whose personal details remain undisclosed, was admitted to the emergency department of Flagstaff Medical Center and tragically died on the same day. Northern Arizona Healthcare, the hospital's operator, stated that despite receiving appropriate initial care and attempts at resuscitation, the patient could not be saved. This incident represents the first recorded death from pneumonic plague in Coconino County in nearly 2 decades, although it is not the most recent case of plague in Arizona, which has seen a total of 7 cases since 2006. The last death from plague in the state occurred in 2007, following contact with a deceased animal that was infected. According to the Centers for Disease Control and Prevention (CDC), approximately 7 human cases of plague are reported annually across the nation, with only 15 deaths recorded over a 23-year span starting in 2000. Most of these cases have been concentrated in rural areas of the western United States. The CDC explains that Yersinia pestis naturally cycles among wild rodents, and while flea bites are the most common transmission route, humans can also contract the disease through exposure to infected pets, particularly cats. The recent death has coincided with an investigation into a sudden die-off of prairie dogs northeast of Flagstaff, which may be linked to the plague. However, county officials have stated that they do not believe the human fatality and the prairie dog deaths are connected. In light of these events, health officials have issued recommendations to minimize the risk of contracting the plague. These include avoiding contact with wild animals, steering clear of sick or deceased animals, refraining from camping near rodent burrows, and not sleeping directly on the ground. They also advise using insect repellent and ensuring that the cuffs of pants are tucked into socks. Coconino County health officials have indicated that the likelihood of human-to-human transmission of pneumonic plague is low, with the last recorded instance occurring in Los Angeles in 1924, according to data from the National Institutes of Health, NIH. Despite this, the symptoms associated with the Black Death, which earned its name from the dark spots that appeared on infected individuals, are still relevant today. Health officials in the U.S. note that symptoms of plague typically manifest within 8 days of exposure and may include fever, chills, headaches, weakness, muscle pain, and swollen lymph nodes, known as buboes, which are most commonly found in the groin, armpits, or limbs. The timing of this human plague death alongside the prairie dog die-off has raised alarms. Plague is just one of several diseases endemic to the southwestern United States, which also include West Nile virus, hantavirus, and rabies. Trish Lees, the communications manager for Coconino County, informed the Arizona Republic that the exact number of prairie dogs that have died remains unknown. This situation prompts a critical question. How prepared are we to handle such outbreaks in our communities? What measures should be taken to ensure public safety? We invite you to share your thoughts and opinions in the comments below. 3. Understanding pneumonic plague. What you need to know. A tragic death in Arizona has reignited fears about an ancient disease that once ravaged humanity. Last week, a resident succumbed to pneumonic plague, the first such fatality in the region in nearly 2 decades. While this might immediately conjure images of the Black Death that decimated medieval Europe, the reality is far more nuanced. Modern medicine has come a long way, and the plague we know today is both treatable and rare. But here's where it gets controversial. Could this case signal a resurgence of a forgotten threat? Or is it a reminder that even rare diseases demand vigilance? Let's unpack everything you need to know about pneumonic plague, its risks, and how to stay safe. Pneumonic plague is one of 3 forms of plague caused by the bacterium Yersinia pestis, the same pathogen responsible for the bubonic plague. The key difference lies in where the infection takes hold. Bubonic plague targets the lymph nodes, causing painful swellings called buboes. Septicemic plague spreads through the bloodstream, and pneumonic plague attacks the lungs. This last form is particularly alarming because it's the only type that can spread from person to person via airborne droplets, making it a potential public health concern if left unchecked. How does someone contract plague? The answer depends on the type. Bubonic plague typically starts with a flea bite, often from rodents like rats or mice. Septicemic plague can arise from handling infected animals or through flea bites. Pneumonic plague, however, takes a darker turn. It can develop as a complication of the other two forms or emerge directly when someone inhales bacteria-laden droplets from an infected person or animal. This is the part most people miss. Pneumonic plague isn't just a new version of the disease. It's a progression or a transmission pathway that requires immediate action to contain. Symptoms vary by type but share common ground. All three forms trigger fever, chills, headache, and weakness. Bubonic plague adds swollen, tender lymph nodes. Septicemic plague can lead to organ failure and shock. And pneumonic plague brings rapid onset pneumonia with coughing, chest pain, and labored breathing. Diagnosis relies on lab tests of blood, sputum, or lymph node samples. Because the disease progresses so swiftly, doctors often begin antibiotic treatment before test results confirm the diagnosis, a critical step in preventing death. So, how worried should we be? The good news is that plague is exceptionally rare. The U.S. sees an average of 7 cases annually, with most concentrated in specific regions like Arizona, New Mexico, and Colorado. Globally, the Democratic Republic of Congo, Madagascar, and Peru report the highest rates. In Arizona's recent case, only 1 person was infected, and there's no evidence of community spread. Health officials stress that the risk remains low, but this doesn't mean complacency is wise. Treatment is straightforward. Effective antibiotics like gentamicin and fluoroquinolones can cure plague if administered promptly. Left untreated, the fatality rate soars to 30 to 100%. A vaccine once existed for high-risk individuals, but it's no longer available in the U.S. due to the disease's rarity. Researchers are exploring new vaccine candidates, but for now, prevention is key. If you live in a plague-prone area, take these steps. Avoid contact with wild rodents or sick animals, store pet food securely, and use DEET-based repellents outdoors. Keep pets away from rodent habitats and monitor their health closely. For most Americans, however, the risk is negligible. This single case in Arizona shouldn't spark panic, but it should remind us that even rare diseases require awareness. And this is the part that sparks debate. Should we invest more in plague prevention research, or is the current approach sufficient? Is the lack of a vaccine a reasonable trade-off for a disease that affects so few? Share your thoughts in the comments. After all, understanding the balance between risk and reality is what keeps public health strategies grounded. Stay informed, stay cautious, and remember, knowledge is the best defense against fear.